just got the call from the OBGYN's office about the gestational diabetes test, and the lady sounded so cheerful on the phone. I thought she was calling to give me good news. And then she said, yeah, you failed the test. So they want me to go to a diabetes care center, nutrition center or something like that. And it does put my pregnancy at a little bit higher risk. I'll have to have more ultrasounds, and there's like a likelihood that the baby will be bigger than like it normally would. And that also brings out the risk of like having a C-section need. And she said that basically for every day for the rest of the pregnancy that I'd have to do like a finger prick. So I'll go to the nutrition center, the diabetes nutrition center, and they'll, I guess, let me know like a certain diet to kind of like stay on, how to do the finger prick, and then like what else I need to do to hopefully keep it under wraps and then not have to use insulin. Like it kind of makes me wonder if that's why throughout like a lot of the pregnancy I wasn't having such a big sweet tooth. I mean, more recently I was kind of having like a little bit of my sweet tooth back, but like even still, like normally I would be able to eat like more of the sweets, and like I like more recently wouldn't finish some of the things that I had, or just felt like, all right, that's enough of that. It's been more like carbs that I've craved, like carbs and cheeses. I feel like I have eaten more carbs than like in like daily than like I normally would with like the pregnancy. And the other thing that I feel like made me feel like something was off, but like I didn't think that like I would fully fail. Like I thought it would just be like, okay, you know, just kind of like be careful. But like if you ever have like a day where like say like the day after you have like a lot of carbs and you have like that weird like taste in your mouth that's like, I don't know, just like feels like extra carbs or something, that kind of taste in my mouth I feel like I've been having like every day for like at least a few months or several months. Few months. I'm not really sure how long I've been having it. So like I kind of felt like something was a little bit off because it kind of like never went away. Yeah. So I know I'm just kind of nervous. I've done like finger pricks for blood donations and they're not my favorite. I'll do anything I can to make sure that my baby's safe, and I want to stay safe myself and healthy. And it also sucks because like my birthday's on Sunday, and we usually do like our Harry Potter marathon, have our butter beer and our sweets and all that. And so now we're just going to have like some of the British food, but not like all that dessert stuff. Yeah, so I guess, you know, I'll keep you guys posted on how the journey goes, how everything works, what the day-to-day looks like after I have my nutrition visit. So I have to call and get an appointment for that. And then I'm trying to figure out the maternity leave thing because I'm probably going to be going out about 4 weeks before I'm due. And then if something happens, they said they'll let me know if I should go out earlier. But like New Jersey does have that. It's like a short-term disability thing where you could go up to like 4 weeks before. So I'll probably be doing that. Yeah. I just feel like really upset and frustrated because like I'm counting down the weeks and I only have like a little bit more than 9 weeks to go, and like I've just been getting so excited for everything and getting ready, getting the baby room ready, and now I feel like I'm going to be more scared than ever. So I called right after and they actually got me in pretty much right away. Today they had an opening for the diabetes nurse educator. And so I went there and, well, even calling the lady at the front desk and the diabetes nurse educator, they were so nice. It's like sometimes I'll go to different places and it's kind of like you can tell that the person just kind of like doesn't like their job or doesn't want to be there, and they were just so nice. And I don't know if it's that they just, they enjoy their job so much and they're like a perfect fit for it. Or I don't know if in addition to that, they know that people are scared going there because like having diabetes is a scary thing. Like on the top of my, like among the top things that I've probably been most terrified, like things that could be like my worst nightmare to have happened in my life, like this is definitely one of them because I've always had such a fear of needles. And ever since I was younger, like I always have loved sugar, and I've known people who have had diabetes before and have had to do the finger prick so many times a day, and that's always been one of my worst fears after seeing them do it. And so I went in there and it was funny because like I had to fill out this paperwork, and one of the questions, it was like, well, ask questions about like, what do you, how much do you know about diabetes? Like, what do you know about like gestational diabetes? And then it was like, how do you feel, knowing that you have like gestational diabetes? And I just wrote like, it sucks. I feel like I was just like, I mean, like, of course, I'm not like excited to be there or to know that I have this. So I was worried about and concerned, but of course, I was also appreciative of them for teaching me about this. And I know that going there is only going to help me, and then like hopefully help so that way my baby will have a safer pregnancy and delivery. And yeah, so we went through everything, and the lady, she was just so awesome. And she we went through everything. We did it. She showed me how I have to prick my finger and check for the blood. It probably took about 10 times because I had to practice, and I was just terrible at getting the blood out. And we tried, I'll have to show you, I have to practice tonight after dinner. And then like once I get good at it, so I can actually know what the things are called instead of calling them thingies. We had to test. Originally we were doing like the depth of 3 for the needle, and then actually we had to switch it to 4 because we're having a little bit of trouble getting the blood out from my fingers. And the lady was like a pro, of course, and so she could get it out like super easily, but for me doing it, I was not very good at it. And she is right that it's not so much like the pain of it, it's not really that bad at all. It's the anticipation of like the needle going into your finger. So I like that you kind of just like press a button and it goes in, and I'll show you guys again like what it all looks like. But I was like super bummed because I was like, no, like why does this have to be like what I have to do now? Like I just wanted to count down to the end of the pregnancy and get excited for everything. I'm already nervous enough for the actual delivery because there's so many things that can go wrong. So now having this on top of it is really scary. She mentioned that, so I have to see the dietitian on Thursday. In the meantime, I'm just going to have like a diary of things that I eat during the day, and then she's going to help me with everything. And I have to test, in the morning fasting, and then within 1 hour after eating. So it's 1 hour after I start my meal of like breakfast, lunch, and dinner. I'll do a test afterwards. And so then like after I eat, they want my blood sugar to be within like 140. And so for the test, the reason I failed, it was in like the 150s. So it's not like terrible, but it is higher than they want it to be. And she was saying that extra sugar floating around will go towards like the baby, and so then the baby can end up being a bigger baby, like 10-pound plus baby type thing. So they want to make sure that there's a safe delivery, that the baby doesn't have any risk of defects or issues later on. So that's why we want to try to keep the sugars down. And she mentioned that gestational diabetes comes from, it's like something to do with like a hormone that the placenta produces or something like that. So it's not necessarily that I wasn't eating right or something like that. And actually, people that I know that have had it have been some of the healthiest people that I know. So I didn't like kind of like think that to begin with, but you just, I don't know, I didn't know like if that was also something like of how that it works. Yeah. Oh, and then she also mentioned that exercising 30 days, 30 minutes a day for like at least 5 days a week would be really good, even if it's just walking, and even if it's not like doesn't result in like weight loss or anything like that. You don't have to focus on that, but it's just the fact of having that 30 minutes of activity is something that can help with this, and especially if it's within like after having a meal. So after I went for that visit and finished up work, I went and took the dogs for a 30-minute walk, and now I'm having dinner, and then I'm going to test after. So that'll be my first like solo by myself practice run, so we'll see how that goes. So it's been about a month since I got my gestational diabetes diagnosis. And when I first was diagnosed, it kind of felt like a death sentence. I was really depressed about it because it was right before my birthday. I had a feeling that that was going to happen, and I had so much planned for that weekend. We always have like our Harry Potter marathon the first weekend of October, and we have all kinds of treats and goodies and everything. But honestly, I feel like this is probably for the best, knowing what I know now, because I think that I probably would have overdone it with the sugar, and that would have not been good for the baby. So I'm kind of happy that I've learned to kind of moderate things a little bit better, and that I can see what's been happening with the sugar levels in my body based on now versus, you know, how it used to be. So initially I went and met with the diabetes nurse specialist, and she provided me with this one-touch glucose monitoring device, and then also this. So this is what it looks like, and then this is the like the Lancet device thing. This is called One Touch Delica Plus, and the Lancets look like this. So they actually get put inside, which I'll like show you how that goes. And then I also got the test strips. So this particular brand device model, she said that this was what my insurance covered. So this is what I got. So you might get something different than this, depending on, I guess, like what insurance you have or what they cover. And so we're in the visit, and she's showing me how this all works. And then she tells me, okay, so now you're gonna go ahead and do this on your own fingers. And I'm just like thinking, I don't want to do this. I don't want to prick my finger. I don't want to put a needle in my finger. But we went and did it. It took multiple tries because I kept not getting enough blood out. And I'll show you kind of like which fingers I usually use, where I usually extract the blood from on the finger, and which fingers I tend to have a lot of trouble extracting blood from. And there is a certain amount that you need. All right, so I start each day with this log, and so you write the date, and then within an hour of waking up, you're supposed to take your first blood sugar. So that's the one before breakfast, and it's considered the fasting blood sugar. Then the second, because this was one of my questions, like I'm kind of like a grazer, so when I eat throughout the day, I don't like usually have a specific time. I just kind of eat when I'm hungry, when I have the availability to get everything put together that I want to. So it kind of just like changes day to day. So now each time that I start my meal, I have to kind of set a timer for 1 hour after. So my question to the lady was, do I start the 1 hour mark? Because it's supposed to, the next blood sugar is supposed to be checked 1 hour after breakfast. So my question was, is that 1 hour after I stop eating breakfast, or is that 1 hour after I start eating breakfast? So she said 1 hour after the first bite of having breakfast. So once I have my breakfast, I have the timer on my phone that I just automatically start that for 1 hour. Then I go ahead and eat my breakfast. And then after 1 hour, I go ahead and test it. Then I'll do this. You can have like a snack in between breakfast and lunch. And actually they encourage you to do that. So that should be like a small thing. It shouldn't be bigger than the size of breakfast or lunch. So then I'll have lunch. And then again, once I start lunch, I'll start the timer for the 1 hour mark. Then I might have a snack in between lunch and dinner, maybe not. And then at dinner, I go ahead and have my first bite, start the timer, and then I check my blood sugar again. And then you can have a snack later after that, but you kind of have to be careful what you're eating. You want to make sure that, you know, you're looking at what you're eating and making sure that it's a manageable amount, nothing that has too much sugar and too many carbs. That's the other thing. And also she did mention about that fiber can be subtracted from the amount of carbs. So fiber is actually a really good thing to be having within your food. So I've been keeping track of these. So this is like an example of what one of my logs looks like. So I would kind of write down like what I ate for breakfast and lunch and dinner. And then in the beginning, I didn't really have anything with like that was out of range. I think within the first couple weeks, I didn't have anything. There's one that was like slightly, one time I forgot. And then there was one night where I had, for dinner, I had, instead of having my salad normally as I would have with lunch, I had my salad with dinner. So I had like a lean cuisine with dinner. I had, oh wait, no, that was the other time. Yeah, so like this one day we went out, we had like an Oktoberfest dinner at this one restaurant, and I didn't think that I had eaten too much, but they want, within 1 hour of eating the meal, they want the blood sugar to be under 140, and that one had hit 173. So that was one of the first times where it really kind of hit a higher number, where I was concerned a little bit and then surprised. And so I realized that I really have to be careful when I'm eating out how many carbs I'm having, even though the Bavarian pretzel was a wheat Bavarian pretzel, it's still just a lot of carbs. So I had to be careful with that. So then another time for dinner, I had, this is the thing that's been scary about it. So it started out that it was kind of scary when I was actually checking the blood sugar, and then it kind of became that the numbers became the scary part. So when I would be about to check, I mean, it still happens sometimes when I'm about to check, even right now when I'm about to check for dinner, sometimes I don't know how it's going to turn out. It could be a really good number, or it could be a high number kind of out of nowhere. So this one dinner I had I went to Starbucks, and I had the same type of meal before, and I had actually had more calories previously and more sugar. So previously I had gone to Starbucks, I had had like the spinach feta wrap, tall pink drink, birthday cake pop. I think that was it. So like 3 different things. And then for that one, my blood sugar had been like perfectly within normal range. So this time I knew that my sugars were kind of bouncing around a little bit. So this was like a few weeks into it. And so this time I just had the spinach feta wrap, and instead of the tall pink drink, I got the tall version of the acai drink, which is supposed to have less sugar. And so the whole total thing, I think, was like 370 calories, which that's about the amount of calories as, you know, a meal can be, or like a lean cuisine might be, which is not that big of a deal. But I guess, I don't know, it depends on like the carbs and you know, things can just throw it out. So my sugar ended up being 189, and I was so shocked by that, because the last time, again, I had more and it was lower. It was perfectly within normal limits. So other things that can affect it, your activity level. So that day after I had the food, I was sitting for an hour in the car because I was driving home from an event in Pennsylvania. And so that whole day I didn't have a whole lot of activity. And if you are having activity around when you're eating, that actually helps your blood sugar. And the other thing is hydration level. So I don't know that day if I was as hydrated as I normally would be. The better hydrated you are, the better your sugar numbers can be. And which brings me to the next example that happened. I had one day where it's like pretty much every single day I was eating the same breakfast. I knew it was a safe breakfast. I was always having a normal number. And then one day out of nowhere, I just had a high number for that breakfast. And I'm like, what is happening? I eat the same thing like every single day. This is something the dietitian said was perfectly fine. But then there's the other part of, you know, it could be your hydration level. It could be, there's so many other factors that go into, but that also makes it very scary because I never know what my number is going to end up being. And so then the highest number that I had, I'd had for dinner, I had a lean cuisine, Greek salad. Normally I have I would have my salad with lunch, but this time I ate late, so I kind of combined it. And I had almond milk with protein, so like a protein shake type of drink. I had 1 date and 1 teaspoon of butterscotch topping that I had made. And I still felt so hungry. So I thought, okay, if my number is good, then I'll have, you know, a little bit more to eat after that, like as a snack. And my number ended up being my highest number ever, which was 221. So then I started getting a little bit nervous. And of course you search the internet and it looks like numbers like 300 or higher. You're supposed to kind of seek emergency services. So then I'm kind of freaking out. I'm like, what is going on? All my numbers had been good that day. And the next day, all my numbers were good. So when I talked to the doctor about it, they said, you know, don't focus so much on one number. As long as, you know, the rest of the numbers are looking good, they're kind of looking at a trend. So if it's trending upwards, and that could be a problem and you might have to need insulin. But if it's going back to normal the next day and all the next few days, everything was within normal range, then it's actually, you know, you just have to be careful of what you're having at that time. So at that point I think that dinner was maybe like 600 calories that I had approximately at one time, maybe a little bit less. So, but it's just crazy because when I would go out to like Red Robin, I might have like over 2,000 calories at a time. And that would be maybe like my whole like food for the day, but I would have it all at one time. So it makes me wonder like, what will my sugars be like if I had that now? So again, like I didn't want to have this, but in a way I'm kind of glad that I know what's going on and you know, that I have to be careful and make sure that I'm spacing these things out. I did notice that if so say I do want to have something sweet or something with like a little bit more carbs, maybe I have like part of it now and then spaced out by like an hour. And so like maybe have like half of it with lunch, half of it with dinner. And then if the dinner number's okay, then maybe I can like from the hour later, I can have like that last little piece of it. So that's something I've noticed has kind of like helped to kind of like balance the blood sugar a little bit. So yeah, this has been, it's been a whirlwind. But overall, I mean, I only have like a few weeks left and it's looking like I shouldn't have to use insulin or anything. I just have to keep on checking it. The only thing is that this could become a permanent condition. I could end up having, diabetes type 2 for the rest of my life. So it's something I have to monitor for a little bit after the baby is born. All right, so I'm about 10 minutes from having to check my blood sugar for dinner. So I'm going to show one example of how I do that. And so first I start by making sure that my hands are clean. So I wash them. You want to make sure that you have clean hands because you're going to be injecting something into your skin. And you also want to make sure you don't have anything sweet on your hands. So if I had some sort of like fruit or something, that could kind of like throw off the sugar number. So again, I want to make sure I'm starting with clean hands. And so then I take the lancing device. And again, this is one of the lancets. So I have to press this into here and then I twist it. I twist it and pull off. And if you can see, that is how big the needle is. Now, The other thing is you can change the gauge on this, and initially we had it on level 3, but we realized it was a little bit, I guess, too short, or it wasn't going deep enough, so we changed it to level 4. So this little thing right here kind of changes that. So then after the lancet needle thing has been inserted, then you put this little lid thing on and make sure it clicks. And then we pull back to make sure that it's engaged, so that way it can inject. And then next, I usually take out one of my testing strips. So testing strips look like this. Take them out. So this is an example of one of the testing strips. And when I enter the blood, it's going to be entered into this little slot right here. You can see that little line across. It's so weird the way it does this, but like the blood touches it and somehow it like sucks it up. I don't know how it works, but it just goes into there. And then the thing you might find if you have to go through this is that a lot of times it has errors. So especially if there's not enough blood on it, then it will result in an error. And then sometimes you have plenty of blood and there's just an error for no reason. The one day I had enough test strips for, I don't know, like at least like another day, and I like woke up in the morning, went to go test my blood sugar, and I had to use my last 5 test strips, trying to use it, and every single one of them ended up with an error. So I don't know why that was happening, but the device ever since then has been fine, no issues. The only time it had an error was when it didn't have quite enough blood. So, and I'll show you kind of like what like enough blood looks like. You want to have like a nice full droplet. And then I'll kind of like show you. So like one thing I've noticed, the fingers that you use the most, like your pointer finger, it's going to be really difficult to get blood from there. I think because it's just, I mean, not that it has calluses on there, but it's just the skin is like thicker, I guess, from being used more. After that, like this side of the middle finger, I have not had the best luck with. I pretty much never use the thumb. The ones I have the best luck with would be the ring finger and the pinky finger. For me, particularly on my left hand, but then I feel like my left hand's a little bit more sensitive, maybe because it is easier to get the blood, but then it also, I think, you know, since I'm right-handed, that the right hand is used a little bit more, the skin's a teeny bit thicker than the left hand. So then, yeah, it might be easier to get the blood from there, but then it hurts a little bit more. I did notice that when I pick a spot on the finger, I'll see later on like a tiny little dot, so I'll know, okay, I you know, took blood from there last time, so then let me go to like a different finger. I try not to use like the same finger too many times. And I know the lady said that the worst part of it is really the anticipation, not so much the pain. It doesn't really like hurt that bad, but sometimes it does hurt a little bit, like depending on what finger. And if you press it harder, like it can definitely hurt more. Sometimes I barely feel it at all. Sometimes it does hurt a little bit, but it's not bad. I still think that if I had to do like an insulin injection, that would probably be way worse. I don't know. I can only imagine. Needles again are not really my thing. But I'm happy that I'm doing this. I'm happy that I know kind of like what's going on with my body, and I want my baby to be as safe as possible. So the lady told me that this part right here is pretty much like the best spot where you can get the blood from. Sometimes I get it from there. Sometimes I'll get it from the front. If it's like this finger or the pinky finger, usually I don't have like too much of an issue getting from there. If it's like maybe like the middle finger, then I would probably like have to go from the side. I kind of switch off, like depending on which hand I want to do. I always get a little bit nervous. Yeah, and I'll kind of show you what it looks like when I'm doing this. And then I always try to keep a napkin nearby. You should wash your hands after, but the thing is, I have to write down on the log pretty much like right away what the number is. So I usually try to keep a napkin right nearby so I can just like wipe it real quick and then write down whatever the number was. It won't show up for a super long time on the device. So you have to also remember that it's going to go away after a couple moments. All right, so I'm going to do my after dinner testing. If you're not good with blood or needle pricks, you might not want to watch this next part, but I'm going to show you how this works. So I'm going to start with pricking my finger. So I'm going to be using this side of my right ring finger. So I have to press this green button and then it's going to engage the needle. So I pressed it and now I'm going to press on the area to make the blood come out. So that's a really good droplet right there. And it's kind of, if it was smaller and I used a different finger and I didn't have enough blood, I would kind of what they call milking it. So you're kind of like pressing hard and pressing up to get the blood to come out, but that's plenty. So now, I usually try to have the test strip available because now that I have blood on my hands, I don't want to be opening the container or anything like that. So I am going to place the fork side into this of the testing, the glucometer. And so this is what it says. Now, you have to wait until it says apply blood because if you apply it too fast before that happens, then it won't work right. So now I'm going to take the blood and as I was saying, it kind of like sucks up by that little strip. So we're going to watch that happen. So it sucked it all up and now it's testing. Write it backwards and it looked like 221, 122. And so then after that, I click and I put that it's after a meal. So this is actually really good. I was really nervous because we just had this really delicious Middle Eastern dinner. We got takeout and I wasn't sure what my blood sugar was going to be. So I'm going to write this down real quick, first of all. So I wiped the blood on the napkin before I did that. And then you want to get rid of the test strip within a container. So what I've been doing is I've been using one of my old containers as like a sharps container because you don't want to have anyone else touching this blood or the Lancet device. So for dinner, I was trying to be really careful. We had like falafel and pita and hummus, and I ordered a mint lemonade, and also we had baklava. So the way I split it up, I just had half of the pita, I had a little bit of the hummus, I had a couple of falafel. Oh, I also have grape leaves. Grape leaves are like one of my favorite things on the planet. But they were small. They're very small. I only had a couple sips of the mint lemonade. So I'll kind of like drink that throughout like the next like day, just like a few sips here and there. Otherwise it has a lot of sugar with it. And I only had one bite of the baklava. So normally I would have had a lot more than that, but I'm just really trying to be careful. And the other thing I've realized is that not all the time, sometimes I'm like super ravenous, but I've noticed that as I'm kind of like proportioning everything out, I'm noticing that like that amount of food, I did feel a decent fullness afterwards. So that made me feel good that this is like a reasonable amount of food that I can be eating. And this is okay for my blood sugar. So so that's one example. So that's, again, I have to do that 4 times a day. The tough thing about it is when I have to go someplace, say like a family event, a friend's party, some sort of outside event in a public area, and you have to go and test because you ate food, or you kind of have to plan your food around when you're going. So say like maybe if I know I'm going to church at, like 12 o'clock, if I eat food at like 11:30, I would have to test at 12:30. So the one time I actually did eat breakfast before I went to church, and then I had to kind of just like, go to the ladies' room and then test within the ladies' room and then come back. Otherwise, I try to plan it so I eat earlier or I eat after I come back, and which is a tough thing because I'm used to eating when I'm hungry and when I want to have food. So this is a little bit of a trickier type of thing. I don't always keep my items in this thing right here. I don't usually keep them like that. I usually just kind of like, I'll put them in my purse just like that, everything like closed up, and usually fits fine because I just have like a small like little purse, but they usually fit fine. Yeah, so this is pretty much how it's been going. You have to be careful with running out of the test strips and the lancet, the lancet things. So make sure that you are stocked up on them for what you need, or you have your refills adequately supplied. And yeah, so otherwise everything looks like it's going to be okay. The baby's been doing well, developing at the right level. If the baby were to be getting too much sugar, then the baby would be getting too big, and then some of the organs and whatnot might not grow at the right level. So that's one of the reasons why this is so important to be taking a look at, so that way the baby grows at the level that the baby is supposed to grow at, a healthy level. And also the other thing is that with gestational diabetes, if you're not careful and things get really bad, the baby could be at risk for stillbirth and all types of different health issues, having diabetes. So yeah, so this has been my journey so far. And with other, if we should become pregnant again, then this most likely could happen also again. So we'll see what happens. Right now, this is what's going on. And yeah, so thanks for watching. If anything else pops up, I'll add that in. Otherwise, make sure to subscribe, and we'll see you next time.